athlete comes into your athletic training room complaining of ankle pain after they fell up the stairs leaving practice on the way to the library. After doing a complete evaluation, they test positive for the Ottawa ankle rule and bump test, so you suspect a fracture. You now must get them ready to go to urgent care for an x-ray. You have crutches, canes, walking boots, and splints available to use in your facility. What do you do?
Bump test, bump test. Okay, alright.
Because the athlete was able to hobble over to your room with partial weight-bearing status, you decided it is best to fit them with a walking boot and crutches to help them get to the hospital. When fitting a boot, the athletic trainer must make sure the whole foot is enclosed with the heel secured against the back of the boot, like a shoe. The straps should also be snug against the foot and lower leg. You decide to give the athlete crutches because they have slight difficulty putting full weight on their injured foot. To properly fit crutches, the athletic trainer must ask the patient how tall they are. Before giving the crutches to your athlete, make sure the integrity of the crutches is intact. Check for loose screws or pieces. To measure crutches, place the bottom 6 inches lateral and 2 inches in front of the foot. Adjust the bottom portion so that it is 1 inch below the anterior fold of the armpit. The hand braces are adjusted so that the elbow is at 30-degree angle when flexed. It is also important to teach the athlete how to use stairs properly. The easiest way to remember is the heaven-hell rule: up with the good leg and down with the bad leg. It is important to note that once they can weight bear with a boot, you can disregard the crutches.
Later.
X-rays came back negative and it's 3 weeks later. There is still difficulty with gait, so a cane can be used to assist the athlete. This can also be replaced with a single crutch. The patient should hold crutch or cane on the uninjured side. The patient should avoid leaning too heavily on the uninjured side and move the cane simultaneously with the injured leg. To review, when providing ambulatory aid to an athlete, the athletic trainer must consider their injury as well as their environment to provide adequate care. There are many other forms of ambulatory aids that can be available to athletic trainers. This includes canes, scooters, walkers, and wheelchairs. Walking boots are great to use if a patient is able to weight bear. However, in many situations, splinting may be more appropriate. The scenario shown in this video is not how every situation should be handled.
Yeah.